I'm Mark Gussy. I'm the director of the Lincoln International Institute for Rural Health here at the University of Lincoln. I have an interest in rural health. So before coming to Lincoln, I was the head of a dental program at the Latrobe Rural Health School. And part of our mission there was to address inequities in the distribution of particularly dental healthcare workers across rural and remote areas. So I've come to Lincoln to extend that work beyond dentistry into broader health and social care research with a particular focus on rural and coastal communities. Data is important for a research institute for all the obvious reasons. We use data, we manipulate data, we report on our interpretation of data. So data forms the basis of most of the core work that we do. Data is important because it's pieces of information or signals from the environment that, when you put them together and examine them systematically, can show patterns which indicate things like associations, causes, so cause and effect, relationships. So those sorts of observations, I guess, of the way data or these signals or pieces of information are put together can be very helpful for making sense of the world and making sense of the problems that we face in the world. So data is really at the core of the work we do, because it helps us in our mission, which is about resolving challenges or problems that are important to us as a society. So big data, as the name suggests to me, and I'm not an expert in big data. I work with data, so I guess I'm an expert in the use of data. But in relation to big data, as the name suggests, is about lots of data or large amounts of data. So in terms of big data, it's about working out ways of dealing with the amount of data. So the volume of data is a challenge that we're now facing. So we have so much data that's potentially useful to us. It's difficult to use the conventional methods of data collection and analysis to deal with the sheer volume of data. So the techniques and the approaches that big data offer us are how to manage that volume. There's also issues around the types of data, so the varieties of data. Once upon a time, and I can remember this time because I'm old enough, there was a focus on a particular type of data. So for example, in dental health, we would look at dental disease data. And we would be able to manipulate that and use that data relatively efficiently. Now we have a broader understanding of the wider determinants of things like dental disease. There's lots of other types of data that we want to bring in. So social determinants of disease, for example, data from healthcare systems, so the use of dental services, for example, or health services. That data is vast, and there are different types of that data. So dealing with the volume and the different types of data is what big data methods offer us. And the last thing, from my perspective, is the speed. So how quickly the data is coming in. And that is increasing exponentially. So big data techniques or approaches offer ways in which we can capture data rapidly, but also use it at pace, similar to the pace at which the data is coming in at us. So all of those new challenges to data are why I think the big data approach is really useful to us, particularly in an institute which looks at health and social care and is focused on understanding the broader determinants of health rather than a small sort of piece of human health. Data is always useful. So we can focus on the use of data at a population level. So data analysis at a population level gives us a picture of the general population. But using data in different ways, we can actually drill down into particular areas, for example, or communities, or even neighbourhoods, depending on the type of data. And that more sort of granular or drilled down approach to using data gives us both the broader picture of the population's status, but we can also draw out or choose particular subgroups in the population and use techniques where we focus on data from that particular area. So it gives us a sense of differences that may emerge in those local areas, and therefore we can be responsive to that in terms of health services or interventions or social care. We can also compare that smaller subgroup, the results from the analysis of that smaller subgroup with the larger population. And in that way, what we do is reveal things like inequities or unfairness in the distribution of disease or other problems, or the allocation of resources. We can examine in a systematic and an objective way some of those inequities. And it's those inequities, I think, that are biggest challenges facing us in terms of health service systems. So that's a way that data can be used with local communities to identify unique problems, but also to help us then think about the solutions to addressing those problems.